Point in time count, here we go.
Good afternoon again. Apologies about that. There were some last minute changes made this morning. So I first want to start off by saying thank you to the community, the COC board, the department. This is a huge lift and we could never do it without them, so thank you. To start off, I would like to level set on the definition of a point in time count, right? So it is a HUD mandated count that you're supposed to capture the number of individuals experiencing homelessness, both sheltered and unsheltered, on a single night in January during the last 10 days of January. So this year, that count occurred January 22nd of 2025, and sheltered is emergency shelter, transitional housing, and safe havens. Now, our community does not have any safe havens, so for us, it's just emergency shelter and transitional housing. And unsheltered is any place not meant for human habitation.
And you're welcome to use the clicker if you'd like.
Oh, thank you.
Yeah, you're welcome. Hi.
And then that is part one, and it's always married to the HIC, the housing inventory count. So that is looking at all of the units available and dedicated to those who are experiencing homelessness on that same night of the PIT. So it is a single night inventory. And it looks at emergency shelter, transitional housing, rapid rehousing, permanent supportive housing, and a special category called OPH, which is really just a combination of permanent housing and permanent housing with services. So the difference there is that permanent supportive housing, there's disability required, and for permanent housing with services, there's no disability required for entry. Okay? And the methodology for both the point in time count and the housing inventory count are mandated by HUD. So this is a map. It's a heat map of all of the locations where we pinged for surveys during the count. Now we do a shelter-based count, so we count for several days and then we deduplicate. We're spread throughout. I do want to point out that we have a slight concentration in downtown, but we did get a very high number of our surveys for unsheltered during the Spokane Connect event, so that did sort of create some cluster around the convention center. And this is actually all of our shelter locations. So the darker blue is emergency shelter, and then that lighter blue is the transitional housing. And if they're sharing the bubble, it means they're in the same location. The bigger the bubble, the more beds we had, or the more people that were there that night. To emphasize, this is a county-wide count. It's not just the city, it's not just the city of Spokane Valley, or just the county. It's every jurisdiction within the COC. So we had a total of 18, around 1,800, 1,806 counted persons and about 1,500 households. So unsheltered, we had about 617 people. And then in transitional housing, we had about 303, and we had over 800, almost 900 in emergency shelter. This is that same count, just broken down by population types. So our adult, child, adult only, and child only. Our largest category of counts where we have people is the adult only, and most of that is in emergency shelter. The majority of our adult child households are actually staying in transitional housing. And the majority of our child only are in emergency shelters. Now this is specific to youth population, so we have parenting youth and unaccompanied youth. So this is everyone 18 to 24 or under the age of 18. In the case of parenting youth, it could be anyone 18 to 24 with a child, or anyone under the age of 18 who also has a child. And unaccompanied youth is anyone, again, 18 to 24, but they're on their own. Yes, ma'am.
And that is a HUD distinction? Is that how they describe it?
Yes, ma'am.
Okay, thanks.
And this is our veteran population. So actually in this year in 2025, we had no households with adult child that were, one of the adults was a veteran counted in this population. We did have adult only, and the total number above the bars is everyone that was in there, all the persons, but we did put the veteran count independently, so how many veterans themselves in that white within the bar. Now this is additional populations, so just because someone is counted in one doesn't mean that they can't be counted in several other. several other categories. So those includes those who are survivors of domestic violence, those adults with serious mental illness, a substance use disorder, or who are experiencing HIV or AIDS. Okay. And now the next two slides are demographics. So I will say that we have breakdowns of demographics for all the population types, or just later in the slides. It'll be broken down into two, where the first one will be race and age, and the second will be gender and chronic homelessness. I will say here on race, there is a category called multiracial. We are working with all of the universities, so WSU, so Washington State University, Eastern, and Whitworth, to be able to disaggregate that data and get a better understanding of what that category is. The majority of the overall totals will be under the white racial category and within the demographic of 35 to about 44 years old. And chronic homelessness, we had around 346 in unsheltered and 345 in emergency shelters. Now, you cannot be, for the purposes of the point in time count, I should clarify because the definitions vary, you cannot be considered chronically homeless in transitional housing. So that's why we never have that category anywhere. The largest category in gender was male, followed by then female. There is a more than one gender, and then we did go ahead and break that down into a pie chart to see those who identified with multiple genders. Now this is our trends from 19 to 25. I do want to point out that we did not do an unsheltered count in 21 due to COVID. So any of the further charts that we have, including later in the presentation where we do trend analysis, between the population types, you'll always see unsheltered in 21 as 0. That's just because we never did a count due to COVID. We have a slight decrease, and similar to last year, but we did increase slightly on our unsheltered. Now we do ask, for several years we've asked consistently on the point in time count, except in 20 and 21, like I mentioned, we didn't do the count. In 20, we just didn't ask the question. I'm not exactly sure why. But we always ask if they lived in Spokane County before they were experiencing this episode of homelessness. And consistently throughout the years, we see that roughly within that 70% range do say that they were from Spokane County before they began to experience homelessness, and were cited here before that.
So I do have a question on this, because our 2023 point in time count specifically has different numbers than this. I cite them all the time, as a matter of fact. And last known residents, the question that we asked in the point in time count that we were given, 2/3 said that they were not from Washington. Their last known residence was not Washington. So can you help me understand that number here?
Well, when you say that count, are you referring to like a previous report that we've put out?
Yeah,
or?
the 2023 point in time count that went out, 2/3 said that their last known residence was not in Washington State. So.
Well, we use that same data here. So if you have that one.
Absolutely, yeah.
And you can send it to me, maybe I can look a bit further into it for you. Yes, ma'am.
So I'm always concerned about that because I look at our central, our city as a hub. So I think people forget that we have a couple of prisons in our area, that people are relocated here when they're discharged, and they just stay in Spokane, or they ask to come to Spokane to get out of whatever situation they're in. Also, the medical hub, people end up here for medical reasons, and they don't leave, for whatever that can be. So I could see how there could be a disconnect, that people are not from here, but due to situations, they end up here. So I think that's challenging for our community sometimes to get its hands around. It's not like the theory that they're just all being bused here. I think we have to look at the other considerations of how people get into the Spokane area.
Of course. There is a committee that we put every year together for the point in time count and about how we word these questions. So if there's any suggestions, please, we would be happy to include those. Okay. And that little chart at the top actually tells us of the total respondents that we had, compares that to our total unsheltered count, so you can have a percentage estimate of how many actually responded. Okay. Now we're moving to our housing inventory count. So we broke down each of the project types here, and so that darker blue is all of the filled beds, and then the lighter blue is the beds that were empty. So we have 4,856 beds for an average utilization of about 80% system-wide. Now, these are our emergency shelters, and we did break it down to include our inclement weather beds separately from all of our other shelters. So our inclement weather, we had about a 91% utilization of all of our inclement weather beds compared to about an 83% utilization in our year-round beds. Okay. And this is our total beds broken down by the household type. So it tells you if they're more for households with children, more for households without children, or children-only households. Now this looks at our trends in beds from 19 to 25. And there have been shifts. I will say that this year, the very large increase in PSH, we worked very closely with the Housing Authority this year to get a very good understanding of all of the VASH vouchers, or the vouchers that are specific for those that are veterans. So we were able to get a better count of those this year. Now this is all of our shelters, beds throughout the years, but we broke it down to look at the beds that were year-round. They're always there, or they're surge. They're there for inclement weather, or they're activated for several months at a year during planned increased times, like December, or, you know, if we have like a fire and there's smoke dangers, that sort of thing. And the number of year-round beds that we've had over years, we've seen that increase significantly, but we have kept several surge beds over the years as well. Okay. And I will step aside. Thank you.
Thank you, Council, and I apologize. I was frantically looking at Councilmember Bingle's email that he just forwarded. I have seen that slide, and we'll get back to you. The one thing that's confusing to me, and obviously that slide predates the staff we have currently, is that it only represents 173 surveys, which in the 2023 pit count, as you saw in the previous slide, the number of unsheltered total was very high. So we'll go back and see what we have from 2023 and see what we can deduce. I would say that the trend line Amanda showed from the pit data that we have, that 70% from the county is pretty stable. The smaller, I think it was green, bar is within Washington State but outside the county. And one thing to Council President's point too is that we know that we do serve the Panhandle and portions of Western Montana, given the lack of resources in those communities. So even on occasion when we have been able to dial even further in, we do see a predominance from the Pacific Northwest, even if from outside Spokane County or the state of Washington. Not saying it doesn't happen, and I'll look further into that slide because I have seen that. Yeah. I just don't know where the 173 came from.
Yeah, because of that 173, you'll see that 98 are from Washington or Idaho, and then the rest, you know, the other 75 are from outside of that area. So,
and we'll see if we have those surveys somewhere to kind of understand which, because even in the heat map from that slide deck, you can see where they surveyed and try and track down. It could have been a Camp Hope impactor.
Yeah, so I pulled this up just to make sure I was right. So what was displayed on the screen is that the question that has been asked is, did you live in Spokane County before you became homeless? But in fact, that's not the question that we were instructed to ask, because I participated in it this year. It was, did you live in Spokane County before you became homeless this episode? Which I think has a substantially different connotation than just Spokane County before becoming homeless. And so if that's not how we asked the question over the years, then I don't think you can compare apples to apples.
Because of the this episode component?
Yeah, I think that changes how you would answer that question potentially.
Respectfully disagree, but we're happy to look at that too and make sure that we are consistent going forward. The couple slides that I wanted to go over with folks, and happy to answer questions too, is just giving a little bit of context to what we're seeing this year. Oh, apologies, I stole it. Thank you. So as Amanda mentioned, we did see an increase in the unsheltered count this year. We wanted to show the total amount of emergency beds that were available in 2024 during the point-in-time count versus 2025. With the closure of TRAC in October and the fact that TRAC was also in a surge capacity during the January 2024 count, we certainly saw that reduction in shelter beds. And even with that reduction, did not see an equal increase in the unsheltered population. So we're seeing some productive movement in the system, but certainly still have some unmet need in the community. And then the other thing we wanted to just point out was some of the things that have taken place since the January 2025 point in time count this current year, which was we have brought on 65 additional scattered site beds. We made 39 formal row housing referrals that folks actually acted upon. And we were able to, for the last couple months of the CAT Sobering Center, receive permission from Commerce to allow for community referrals. And we did see a huge intake at the CAT Sobering Center from unsheltered populations during that time. So certainly some resources that we've seen come online be successful that we know we need to continue to invest in to be responsive to that unmet need. And then also just some things that we noticed that we want to further evaluate based on this year's point in time in the HIC count. The top one, and we had presented some numbers from this, we're identifying some challenges in the HIC versus how we represent utilization. So in the housing inventory count, we are accounting for each bed in the system. However, when we look at utilization, we're counting bed units. And so we have this disconnect. One example could be that there could be a 3-bedroom apartment where we're counting 3 beds for that unit. But if it is leased to a single household, the unit's full, but 2 beds are unoccupied, and that's counting against our utilization. So Amanda and her team are working closely with HUD to do some updates to the HIC, and that'll help us get a better understanding of our utilization of PSH right now, which when you look at the percentages, they don't match the number of units available. So just trying to get a better understanding of that so we can make some informed decisions. And then also looking at our emergency shelter utilization. So on the night of the HIC, we did see shelter beds that were available. Not as many as we would probably like to see available, but nonetheless, there were beds open. And so also trying to understand and establish better communication pathways and partner engagement to make sure that if there's a bed available, somebody knows they can access it. We did take out, as I mentioned on the slide, the Westminster respite site had opened 9 days before the HIC, and it's referral only, so it was admittedly not full the night of the point in time. So I did pull that data out of this one particular slide just because it gave an inaccurate representation of what was happening at the time. And then one last thing, just kind of wanted to highlight the investments that are underway in response to the point in time count, but also in response to just the myriad of needs we've seen in the community. So the HEART and Affordable Housing Initiative investments will actually be in front of you later this afternoon. That was about $7.5 million in affordable housing that went out for RFP, and those results will come to you for approval starting today. We have 2 or 3, open NOFOs. One of those is the City Outreach Program, which is based on a lot of community feedback of what ways to be more intentional with our outreach efforts and deeply investing in outreach to better align with what we're seeing in the unsheltered need. I would certainly encourage council members to look at that RFP. We're excited about this new model in partnership with PD to be really intentional about how we're reaching each neighborhood and unsheltered populations. The Daytime Navigation Center is also out right now to do our daytime drop-in services, and then we've put out the inclement weather NOFO, which I think you all saw in the last week or two. All 3 of those will close July 31st, and then in August we will put out our homeless prevention funds, which will flow to us via the county from state commerce dollars, as well as we're anticipating to go out with the affordable housing and behavioral stabilization services, partially from the 1590 HEART account and partially from a home ARP account. Those will both go out in August with the intent to be in front of council around the Halloween window. But nonetheless, an $18.6 million investment, trying to be really intentional about how we address the needs from the pit and also just from our experiences over the last 12 months working in this space.
Don, could you be more specific about your comment about the stabilization? Is that partnering with the county and their new stabilization? Or are we standing up something of our own? Or what are you speaking to?
No, sorry. In the last round from Commerce, during COVID, there was a substantial investment made in what they were calling at the time eviction prevention funds. In the last Commerce budget, the city directly received from Commerce $3.4 million of that fund. In this last biennium, Commerce reinterpreted the legislation to mean that only counties could be recipients of homeless prevention funds. They changed the name from eviction prevention to homeless prevention. And determined that those funds must go straight to the county. The county in turn worked with us to ensure that we still received our same $3.4 million allocation as a subrecipient to the county that we will then administer within the city for the same dollar value, but instead of receiving it straight from the state now, we have to receive it from the county as pass through. Yeah. And that is new this year. So, and you will also see later today you have the Commerce contract coming for you for acceptance as well to go administer funds. That 3.4 million will come from the county at a later date. Yeah. And I think that's the end for today. There are a series of additional slides here that get really specific into demographics that we'll share with council, but we would take up your whole afternoon if we tried to get through them today.
Yeah. And can you talk about potential impacts of federal cuts to all of these types of services now or in the future, kind of what that landscape looks like?
Yeah, so I think, as you all probably saw last week, the Community Development Block Grant Program remains on the chopping block. That's about $3.4 million a year that comes to the city of Spokane. The county receives its own allocation, so as a region, it's a pretty substantial sum of funds. Those CDBG dollars do really critical work. They are not homeless services specific. 20% of those funds go towards public services. Right now, we're funding things like childcare expansions, workforce training programs, domestic violence survivors treatment programs. The bulk of those funds actually go to capital projects. Notably, we just came before you all for the partnership with Parks and Neighborhoods to do parks improvements. It also funds things like HVACs at daycare centers, smaller capital investments that are critical to community centers and other community-focused services. The home program is also uncertain. It allocates about $1.5 million a year to the city of Spokane, again with the county getting its own allocation. Those are investments specifically in affordable housing with long-term 25 to 40-year affordability terms. You'll see some of those recommendations from last year's money before you as well today. And then the continuum of care is the last federal project that's really uncertain at the moment. As if you may recall, and John will speak to in just a minute, our continuum of care dollars in this most recent round from HUD were actually given a 2-year funding cycle, which was an incredible opportunity for our providers to have some stability in our continuum of care services, which includes things like HMIS, coordinated entry, permanent supportive housing. The original proposal potentially eliminates the COC, which would be a very detrimental impact to Spokane. That's over $6 million, so we're talking about $9-10 million on the line here. The most recent indication has been potentially maintaining the COC, but not acknowledging the 2-year NOFA process we just went through, and requiring communities to recompete for an unknown amount of funds and potential shift in eligible services. So facing down some pretty serious impacts, yeah.
Don, is not the COC a requirement for HUD funding?
I'm sorry, what?
Is not the COC a requirement for HUD funding?
It is, and the continuum of care, which is a funding package that requires that board to be in existence, and that's about $6 million a year that we receive from HUD that the continuum of care board oversees. The federal budget proposes several potential different arrangements for the COC altogether, one including elimination.
When we're talking about different stabilization centers and shelters and things switching to a reimbursement model, how much of that is Medicaid, Medicare type reimbursements?
So the predominant way that Medicaid is used currently in the shelter system is through the respite programs. We actually met with Chaz last week and Better Health Together probably 2 weeks ago. We're reconvening in a week or two to talk more. The state had been prepared to bring a substantial waiver to the table to support respite. That has been completely put on pause by the healthcare authority. So I think those contracts that we were anticipating to be any day now are now TBD. So I think we will see substantial cuts to respite care.
This isn't a question. I was just going to make a quick comment. Just having participated in the point in time count this year, and I had shared this feedback with Ariel earlier, but just a couple things that kind of jumped out at me. And I think we all know that it's not a super accurate, but it's sort of trying to give you an idea. But one of the issues I saw was just the significant size of the geographic area that volunteers were assigned to cover. The area that we had was Hilliard, and I think we maybe walked 15% of it by in the time frame that we had. And so how many may have been missed or overlooked, I think is a definite concern. And then also just kind of the unreliable feedback that you get. One of my takeaways, you would be interacting with somebody, and you can call me judgmental if you want, but it's pretty clear kind of what the issues are that they're dealing with, and yet their answers do not reflect those issues. Maybe it's, is more treatment services something that would be necessary? It's like, oh no, we don't, I don't have an issue. And so I think there needs to be a way to collect the observers information as a part of the point in time, in addition to what their feedback is, because I think that that would help just give a little bit more context and maybe accuracy to it. And then also just as you're interviewing individuals out on the street, and again, this can go for a lot of reasons, but through the questions you're asking that you're told to ask, they might give you one response, and then through the casual conversation that you might have with them throughout or after, they will give you responses that are actually conflicting with what they had told you prior. So trying to understand exactly how accurate things are, what the true, situation is, I think is a little challenging. And I think we recognize it's not a perfect system, but I'm just hoping we can maybe figure out some ways to address some of the deficiencies in the future, just to try to get it as accurate as we can. So. Yeah,
and we totally acknowledge that. We know the point in time it's not a complete picture, and that's part of why we come before you quarterly with our system performance reports, because we know that that's a far better indicator of our project performance, and where we're getting far greater detail and data about clients served, because we do then have providers, to your point, entering information into the HMIS system. And we're always open to feedback on the questions and the formatting, and that committee will reconvene here pretty soon for next January, so we would welcome that feedback. Yeah.
All right, I've got a couple things here.
Okay.
So our new HUD regional director is pretty intimately aware of Spokane. Have we been connecting with them at all recently?
Not with him directly, but with our HUD reps for sure.
Okay.
Yeah.
Okay. I would encourage us to lean into him. I think he is absolutely.
Yeah. And we do our COC and our housing authority are very engaged with him.
Okay.
Yeah.
On one of the slides here, it went over mental disorder and substance use. Can we put that back up? Because I have some questions on this. So I think if you totaled them up, if they were unique individuals, it would be about 1,200 that were between mental illness and substance use. But I think you said that they could be co-occurring.
Yeah.
Right.
Yes.
Okay.
Yeah. Somebody could answer yes to all four of these categories.
Sure. And do we know that amount there? Do we know 50% of the people with serious mental illness also have a substance use disorder, or vice versa?
That's a really good question. That's actually part of what we're partnering with the universities for, to actually see how many of them have some crossover. And it's not only in shelter, but also in unsheltered. Previously, that's been looked at really like unsheltered, but we want to also break that down into our sheltered category. So that is part of that big report that will come out from the universities as well.
Wonderful. And the reason why I ask is, regularly what we're told is that it's a housing problem. And I don't disagree that there's a serious housing component to this. But when I see data like this, if we have 1,800 who are unsheltered, and at the bare minimum we have 700 folks who are struggling with something pretty serious, I do think it's something, and I'm not saying we don't, but I would like to see a little bit more balance in our conversation when we're talking about it, not just only being housing focused, because there's a lot more to this. So.
Absolutely.
Wonderful. Thank you. Anybody else? Yep.
Just a quick question is, working with the universities, so when we look at co-occurring disorders, substance abuse, mental illness, are there any other co-occurring disorders that will be captured in that data, or just those two?
It'll be substance use, but substance use is broken down like alcohol and drugs, and then mental illness. We do have other additional barriers that we can explore with the universities, but those are more something that would look at exclusively within the sheltered. We don't necessarily have that data for unsheltered, because it would come out of HMIS. It's slightly different what we can get from unsheltered versus sheltered.
And I would say too, this is self-report, so.
Yeah.
I get the HMIS system where we also ask these questions is going to have a better representation. Same scale of problem, but more accuracy probably.
When we get into disaggregating that data as well, though, just because in the survey you find that someone had a substance abuse disorder when they got surveyed, I've been warned over and over again by providers not to conflate with that as a cause of homelessness. A lot of folks end up homeless because of economic reasons and become addicted after that.
Yeah, I don't disagree with any of that, but again, when we're having a community conversation about it, it feels as if it's anybody who says, we have an addiction problem, or, we've got a serious mental illness problem, they're sort of poo-pooed as bad people, and that's been frustrating. Because it is a serious housing problem, but there are real human spirit brokenness issues that we're dealing with as well. And so I don't want those to be, you're a bad person because and that is oftentimes how the conversation is portrayed.
No, and I appreciate that. I think that's part of where, the all of the above approach comes from, because we know that, yes, housing is part of this crisis, as well as addiction, as well as mental health, and there's a myriad of interventions that need to be deployed to get our hands around it, and housing is one of many. Yeah.
I would just add on to that, that the mental health and the addiction problems happen in the housed community as well. So it's not necessarily a bigger fish to fry, but it's a much broader thing than housing.
All right, thank you
Thank
so
you, guys.
much.